Hi guys, this is Dr. Dalton from Hammond Chiropractic, and today I have another special guest for you here. Her name is Sydell. She's one of my favorite patients, and I know I say that about everybody.
Yes.
But I do love seeing her in the office.
Yes.
And so I invited her today because I wanted her to talk to you about her experience in the office and what she came in for, because what she came in for is something different than most people would think you would go to a chiropractor for. So Sidel, why don't we go ahead and start? I just want you to go ahead and introduce yourself to everybody first, and then talk about what you came in with and what your experience was here.
Yes, my name is Sydell Hatchett. And when I first came, I think that was around October, but in the last part of September, I noticed that my right, just above the knee, right knee, I got a lot of fluid in it. I didn't know, and I went to bed the night before, and it was fine. And then the next morning I got up, I noticed I couldn't walk. I limped to the, washroom, and then I got a hot towel and put it on there and did that several times, and nothing happened. And then I looked, I said, oh, my knee, it was swollen like twice the size. So then I got, tried to get dressed, and I went to the emergency room at UIC in Chicago. And they said I had pseudo gout. I guess that's like fake gout. It's like gout, but it really isn't gout.
Yeah.
But they had to take a lot of fluid off of my knee. But, I was in so much pain. And a friend of mine told me about and he said, I want you to come. I'll take you out there because I don't drive. So I said, okay. So we set up the appointment and everything and came out. And he just worked wonders with my knee. And it's been in good shape ever since. That right knee is better than the left knee. Right. But I'm going to always come here. I'm not going to stop. Some people go for the treatments a while, and then when they feel better, they stop.
Yeah.
But I'm not going to do that because I don't want to risk having that happen all over again.
Oh, sure. And, a couple things that I wanted to bring up, too, about your situation was literally when you came in, that knee was about double the size.
It was
really swollen. And that was even after you had gone to the emergency room and had the fluid drain, wasn't it?
Yes, it was.
Okay.
I was in so much pain.
Yeah. And, one thing that makes that people don't realize is that when I have a patient come in, people think that chiropractors just work with the spine or with the back. And that's partially true.
Yes.
But we treat all joints of all kinds. But what's different about going to the chiropractor for a knee problem is that not only do we look at your knee, but we also want to make sure we check the lower back, because that's where the nerves are that control how the knee heals.
Yes.
You want to make sure that all the power is turned on the lower back so that the knee can heal as quickly as possible.
Yes.
And one thing you had mentioned that I thought was interesting that I want to ask you about too, you've gone through care, we've gotten the knee under control, everything is a lot better with it, and now you can continue to come in for what we call wellness care or maintenance care.
Yes.
Do you feel like that helps keep you going because you come in?
Yes, I really believe that, because if I stop coming, then it might go back. Whatever led to that could possibly, happen again.
Oh, sure.
And I just want to always come periodically.
And just make sure we prevent it.
Right, that's right. And
that's real wise of you.
Exercise and everything. And sometimes I put that aspirin cream in the BioFreeze.
Oh, yeah.
My knee, I keep, plenty of that so I can, have it.
Right, keeps you going.
Right, keeps you going. I'm just so glad that a friend of mine, introduced me to Dr. Dalton.
Yeah, well, I appreciate it. And, of course, like I said, we love seeing you, that's for sure.
Yes, and then you get in and get out real fast. I don't know no other place you can go in. And they keep you hours and hours.
Yeah.
Then, you have to go home. You have to cancel what you were going to do for the rest of the day. Because, you're out of time.
Yeah. No, and that's one of my biggest things, because that's one of my pet peeves. I can't stand when you go to a doctor's office and you have to wait forever. So the rule in my office, we try to be as efficient as we possibly can to make sure we get you back to your life, because you don't want to spend your day with me.
That's right. That's right. Just a little time.
right, exactly. Just enough that we can laugh for a little bit and get you all taken care of. But yeah, my office, my rule is we try not to ever let you wait more than 15 minutes. That's what we try to do. So, no, exactly. We want to make sure we get you in, get you taken care of, so that way you can get back to your life and enjoy yourself.
Yes, that's right. That's right, yes.
But, one more thing I wanted to talk about here, because one thing about Sidel that you guys don't know is that she's very, very active. And, remember over the holidays, you make cakes, don't you?
Yes.
Is it cakes? Yeah.
My specialty is really pound cakes. Cream
cheese
is
that what it is? Okay.
With caramel frosting or without,
Oh, man.
Or maybe some ice in it like that. And it comes out, all my friends I just started making, cakes for like a person's birthday, a gathering at the church. I'll donate a couple of cakes. And then people start letting other people try it. And then I said, I'm in business.
Right?
I got a little side hustle.
That's right.
I'm
I
into
love
it
it.
now. I love it.
Yeah, because I remember over the holidays you were so busy making so many different cakes, and and I felt good that we had got you feeling better enough that you could stand and you could do all of that without having to stop your life because of it. So that was incredible.
That's
but
right.
Yeah,
it keeps me going because if your knee is in pain, you can't be trying to fix cakes sitting down and everything. You need to stand at some point.
Oh, I believe it.
And walking back and forth and getting up and down. So
not that I would know. I'm probably the worst cook you could ever possibly be.
I'm going to have to fix you a sample cake.
Oh, there you go.
Bring a little sweetbread in.
You're going to ruin my diet for me. That's okay. I don't mind. Well, that's pretty much it. Do you have anything else you want to tell everybody, Sidel, or we feel like we covered everything good?
I think we covered everything real good. I'm just so glad that, to have found, come here and get the treatments and stuff. I'm just so ever grateful to you for that.
Oh, you're very welcome.
Mm-hmm.
Like I said, I'm just happy we've been able to help you so well.
Yes.
So
let's keep it going.
That's right. Well, thank you for doing this with me, and then we'll see you guys on the next video then.
Yes. Okay.